Welcome to Smithville Chamber Chatter, coming to you from historic Smithville, Texas. We're here to talk about all things Smithville, including upcoming events, updates and tips for and about local businesses, important news, election updates, and more. Brought to you by the Smithville Area Chamber of Commerce, I'm your host, April Daniels. Welcome to our podcast. Good afternoon, and welcome to the Smithville Chamber Chatter podcast with your host, April Daniels. We are excited to continue our podcast series today, sponsored by the Smithville Area Chamber of Commerce, and today's sponsor, Farmers Insurance, Scott Saunders Agent. Our guests today are Janice Bruno and Charlene Shaler with the Smithville Whole Health Partnership. Good afternoon, ladies, and thank you for being our guests on the Smithville Chamber Chatter podcast.
It's a pleasure to be here today with you, April. Thank you for having us.
Again, thank you so much, April, for having us. It's so important to get our information out to everyone, to let them know how wonderful the Whole Health Partnership is and what we do for the community. Janice is going to give you some information about what our mission statement is and what we do.
Thank you, Charlene. I so appreciate that. And Janice and Charlene, I know our viewers and listeners are very interested in the health and well-being of our fellow citizens. Tell us about the Smithville Whole Health Partnership, what you do for the community, and your mission here in Smithville.
Get on the fast track, Smithville. Back in 2015, the Whole Health Partnership was initiated because we were trying to apply for a Robert Wood Johnson Foundation grant. So there was a group of us that got together, and that included the city of Smithville, our Wesley nurse, the hospital, Seton Hospital, the Friends of the Library, the library itself, and who are we missing? Smithville ISD. So we all came together to apply for this grant, and then we said, why don't we form this Smithville Whole Health Partnership? So we came up with a mission statement, which is to build a better network for health in the Smithville area and the surrounding communities. So with that, we started focusing on the much work that needed to be done. We conducted a couple forums back in 2015 and 2016. We conducted a couple health fairs. And what we tried to focus on were 4 different areas, okay? So we focused on health behaviors, which is alcohol and drug use, diet and exercise, tobacco use, clinical care, access to care, and then the quality of care. And then our social and economic factors, which were our transportation, employment, community safety, family and social support, and income. And then the last area is physical environment. That's air quality, water quality, housing, and transportation. So those were like the 4 main areas. Then we had to sort of come together and say, okay, what do we want to focus on? What is some of those areas that are really, that have to be taken care of in Smithville that has to do with health? So being the executive director for the Smithville Community Clinic, one of the areas that, my focus was the clinical care piece, the behavioral health piece, the medical piece, the dental piece. And then each person in the Whole Health Partnership more or less got a little bit of an objective or a goal for their area. So I will come back to what the clinic is doing for access to care and for quality of care, but I'm going to let Charlene talk a little bit of how the Wesley Nurse then fits into the Whole Health Partnership.
So the Wesley Nurse is a health component of the Whole Health Partnership. We really look at exercise, diabetic education, diabetic equipment, the things that can help people with diabetes. I also have gift cards for those people that need help with gas and trips to the doctor and things like that. I do some counseling from time to time as well. We have diabetic bingo, which is a lot of fun and a lot of education for our people. And unfortunately, because of the COVID, we're not having it right now, but we're looking for it in the future. It's very important to be out there and to be available for the community, to let the community know about not only what I do as the Wesley Nurse, but also what the clinic does for our community. And Janice has been such a big help here in guiding the clinic and getting us to where we are today. the Wesley Nurse is a faith-based program, and so I serve the underserved, the underinsured, and the people. I just serve everybody, anybody. It doesn't matter whether they have insurance or not. I'm able to help them. The Whole Health Partnership, like Jenna says, has had several forums. Right now, we're reaching out to the public with the Old Towers nursing home. The items that were left in the old nursing home are going to be up for sale the 6th, 7th, and 8th of August, and Janice will have more information on that. Janice, I'm going to hand it back over to you.
And actually, Charlene, before we kick it back over to Janice, I just want to be sure people know that your Wesley program, that is run, you office or work through the Methodist Church. Is that correct?
I do. I'm not the Methodist nurse. I am, but I do work out of the Methodist Church. My office is at the Methodist Church.
And is that how people who are interested in your program would contact you, by calling the Methodist Church?
Just so you know, there are 85 Wesley nurses in this part of Texas, and we all serve the same way. We all serve the underserved, the underinsured, and help them with a better health program.
Yes, ma'am. So I know that you're both very interested and excited to announce the sale that's going on as part of as Towers Nursing Home moved to their new location. They left some items there that they very generously made available to your program. So Janice, why don't you tell our listeners and viewers a little about that?
Okay. Well, the Towers moved to their new location in November. And the way that this Whole Health Partnership got involved was the clinic, the Smithville Community Clinic, is expanding. We're the only free and charitable clinic in Bastrop County. Dr. Desmar Walks is our medical director. She's also the Bastrop County medical director. We are expanding our clinic. And so when we got to go through a tour of the old Towers Nursing Home. They had some exam tables, which I was very interested at the time, with some other medical equipment that was left behind. So we made a proposal, Charlene and I did, to the Hospital Authority Board and to the City of Smithville, that the Whole Health Partnership sort of take over the things and remaining items that were left there and have a sale to raise money for the non-for-profits in Smithville, to include the clinic, the City of Smithville, the Wesley Nurse, Seton Prescription Assistance Program, the library, the We Grow, We Cook, We Eat program. So all those programs that are non-for-profit that would utilize those funds and give that money back out to the community. We have, hundreds of items for sale. So that list will be going out on Facebook today and on Nextdoor with suggested donation prices. And we are going to have the sale on Thursday, Friday, Saturday of 6, 7, 8 August, and from 9 to 2. We will follow
at the old Towers Nursing Home location. Okay.
And follow all COVID protocol for that sale. There'll be only 35 people at a time, similar to how they do born again enrollment.
And that actually leads perfectly well, as you mentioned, COVID. I know we're all concerned. The numbers are going up, as we hear, day by day. So as you all are both working with your different organizations that you represent, I know our viewers would like to hear about what you're doing to follow those health protocols, but at the same time, tell our viewers just real quickly, Janice, about Charlene already did tell our viewers about the Wesley Nurse Program, but why don't you tell our viewers what it is that the Smithville Community Clinic offers? And I know you also offer some virtual or face-to-face online doctor visits or medical care provider visits. Can you talk a little bit about that?
Sure, thank you. Since COVID, we shut the clinic down on March 17th. We were closed for about 2 months. We were able to reopen for 30 days. But as far as our providers go, a lot of them are, elderly providers, so they started to do telehealth. Currently, the clinic is closed. It's physically for patients to come in for inpatient visits. The goal is to open up on 1 September with our new clinic and be able to start seeing patients in the clinic. But right now, you can still call Monday through Friday from 9 a.m. till 1, 237-2772, and the clinic coordinator will make an appointment for you and will get you seen via telehealth through our new nurse practitioner who lives in Smithville now, and she is at the clinic 3 days a week. So she is seeing those patients along with an RN via the phone. And we also have a bilingual patient navigator, so Spanish-speaking patients can also call in and make those appointments. The second thing we had to shut down, but we will reopen, is dental. We didn't have enough personal protective equipment, and now we've been able to get that through generous donations from the St. David's Foundation, AmeriCares, and Direct Relief. The goal is to open up. We now have 2 new dental providers, and we will kick that off 1 September, pending approval, of course, from the medical director. And then the third program that we're running, of course, is our behavioral health program. We have 6 licensed professional counselors. You can go out to our website. There's a number you can call. If you're needing to talk to a counselor, it's totally free. Our behavioral health counselor will call you back, and you can start having sessions for free in behavioral health or licensed professional counselors. So we were totally blessed, again, by the St. David's Foundation to be able to provide that service for the city of Smithville. So right now we're open, and we're trying to, we've got all our personal protective gear.
Right,
Now
and you're doing your very best to serve the community while also being safe. I'd like our viewers and listeners to take note here. Either you or someone that you know or some organization that you work with. Right here in Smithville, we have this free clinic available to our members, to our community members. They have dental, they have mental health services. The Wesley Nurse Program has multiple programs available for our population. This is a great example of how Smithville pulls together and takes care of our community and our surrounding community. I urge those of you that are listening and viewing today to share this information with your network and let them know that these providers are here, that they're ready to make sure that our folks here in our community remain safe and remain healthy, which of course goes right into this larger organization, which is called the Smithville Whole Health Partnership, where different groups work hard together to make sure that our community is healthy and well cared for. I would like to take just a moment to thank today's sponsor of our podcast, Farmers Insurance, Scott Saunders agent. Many of you know Scott Saunders, of course. He works so hard to always support the many things that the Chamber is doing and all sorts of organizations in our community. So thank you, Scott Saunders and Farmers Insurance. Now, I would like to ask you, we keep talking about your partnership. I know we've already talked about the clinic and we've talked about the Wesley Nurse. I'm assuming there are other organizations involved in your partnership as well. What do those particular partners do? And can you talk a little bit about how a health organization or other member of the community can get involved with the Smithville Whole Health Partnership?
The Whole Health Partnership is open to anyone. We meet once a month. Right now we're meeting on Zoom, but you're more than welcome to come and join us. Let us know. We want your ideas. It's really for the community. What do we need? Open your hearts and open your minds to us to let us know. What do you think we need? We work for you. It's so very important that everyone know that. There's, the school is involved. Sophie Weinheimer is one of our Whole Health Partnership folks, and the school has been greatly involved in what we're doing. We grow, we cook, we eat, along with the library. That has been a huge piece, and of course the clinic in the Wesley Nurse. The city, Jill Struby, has been right there with us, fighting for what we need to do and how we need to get done what we need to get done. So.
And we just recently got a new member, Dr. Linda Wilson. We're part of a bigger consortium out of Bastrop County and then out of Austin for the Breast Coalition. So she has recently come on board as a new member. We are trying to right now increase the number of screenings for Well Women's. I didn't mention Well Women's, but we do Well Women's clinics. And so Dr. Wilson has been instrumental in getting us involved or coming on board with the Whole Health Partnership. And then some of the other members have been the It's Time Texas. It's Time Texas has come down and helped us. Of course, we've won for 3 years in a row the challenge, the It's Time Texas for Small Town Challenge, and Born Again Emporium. They're part of our network. So there's been several people that have just started, really morphing this thing into, and I can provide this to you, April, that shows
Yes.
how the network has really expanded and how, we're touching so many folks out there. But yeah, anyone can join in on a weekly, on the monthly Zoom call that we have. We'd love to have you.
And they would contact either one of you to
Yes.
get some information, or contact the library and speak to Judy Bergeron there.
Jill.
Certainly, those of you that are listening and viewing can contact the chamber as well. We'll be happy to give you phone numbers and contact information. Finally, now I know we've talked a little bit about your fundraiser that's coming up in August, but tell us a little bit. I know we're all overshadowed by COVID right now, but what I'd like to hear, and I'm sure our listeners and viewers would like to hear about, is your priorities and your programs that you're looking at doing over the next year or so. What can we look forward to from the Smithville Whole Health Partnership?
We're going to have a cooking class. We had one cooking class earlier in the year, and it was such a huge success. And it's teaching how to eat well, and to eat right for what you need. Are you a diabetic, or, do you have heart trouble? Are you obese? What is your problems? And so we're cooking according to what your problems are. We've had a chef join us, Chef Catherine. She has joined us, and she is teaching us how to do and what to do. The plan is to have a cooking class for kiddos and to have a cooking class for our men folk. So that will
Wow,
be,
great.
Yeah, so that's plans for the future right now.
Sure. Janice, is there anything you'd like to add?
One of the other things the Whole Health Partnership is focused on, of course, is affordable housing. And of course, I know the Chamber's been real involved with that, working real closely with that committee. There was Affordable Housing Innovation Solutions that came out of Wells Fargo. So we knew that housing was a big deal. We knew transportation was a big deal. Sort of that got put on the back burner, but I'd like to see that come back up to the forefront, which all ties in, of course, to the Chamber's economic development. And then, of course, the education, working with, we've gotten involved with the STEAM Academy. That could be coming in the future. So that's something to look forward to, working with our kiddos, because that has everything to do with health and mental health.
So both of the things that you just mentioned, Janice, and as well as Charlene, again, these are such great examples of how in Smithville we all work together as partners. Different organizations come together and then move on to other projects, and these different organizations partner together to make it possible for us, all of us, to work so hard to bring so many great programs to our community. Janice just mentioned the STEAM Academy. For those of you that don't know what that acronym stands for, that's Science, Technology, Engineering, Arts, and Mathematics. Look at me, I got it in the first try. That is a partnership that works beautifully, not just with the Chamber, but the school district obviously is a huge part of that. Everyone working together to help our kids, help our seniors, help people with serious health issues, all together. All of us, particularly Janice Bruno and Charlene Shaler that are participating today in this podcast, want so much to reach out to the community and be a helping hand and work to do good things in the community. And I commend you both for your hard work. Thank you, ladies.
Thank you.
Of course. Now, I want to again say thank you to Janice Bruno and Charlene Shaler of the Smithville Whole Health Partnership for appearing with us today for this episode of the Smithville Chamber Chatter podcast. Be sure to join us Wednesdays at noon for the continuation of our podcast series. We have new business owners, community spotlights, and event podcasts coming up. Again, ladies, thank you both so much for participating and for being here and letting our community know about what you do.
Thank you, April.
Thank you, Janice. Thank you, Charlene. So until next time, we'll see you in Smithville, a big small town experience. Thanks, everybody.
Bye-bye.
Bye-bye.
Thank you for listening to Smithville Chamber Chatter with your host, April Daniels. If you'd like to be a guest, email us at april.daniels@smithvilletx.org. Between now and our next episode, be sure to check out the Chamber's website at www.smithvilletx.org. Until then, we'll see you on Main Street.